Elvis Presley is revered around the world as he left a gaping hole in the fabric of rock and roll history back in 1977. On August 16 that year, he was found unconscious on his bathroom floor by his girlfriend Ginger Alden. Attempts to revive him were unsuccessful and he was later pronounced dead, but the original autopsy has never been released to the public. The Caught in a Trap hitmaker would have marked his 88th birthday today, but sadly died of a heart attack at the age of 42 at his Graceland home in Memphis, Tennessee. But a mystery has shrouded the king of rock and roll's death for almost 50 years after his family remained tight-lipped on the results of his autopsy, and the original results have never been released to the public, but reportedly will be shared in 2027. He was found in his bathroom and was pronounced dead when he got to the hospital and shipped immediately to the morgue, where an autopsy was carried out that very afternoon. His official cause of death, given by the coroner 3 days later, was listed as hypertensive cardiovascular disease with atherosclerotic heart disease. Express.co.uk takes an inside look into the jailhouse singer's health woes, from complaints of being constipated for months to his body being covered in sores. According to reports, Elvis suffered several complaints and he was found unconscious on the bathroom floor by his girlfriend Ginger face down in front of the toilet, after collapsing from his sitting position. When paramedics arrived he was already dead, so cold he had turned blue. Ginger has since recalled the horrifying details of that fateful day, writing in her memoir, Elvis and Ginger, how she had stood, paralyzed, upon discovering the late musician.